Hello and welcome, JP from Smitten Kitten. I am truly grateful to have you be a part of this World Menopause Day Summit. And as I've mentioned, anyone born with an ovarian system will transition through menopause due to the just natural shift of hormones marked at 365 days without a period. And it's estimated that 80% of people will experience at least one or more of the 50 plus symptoms, such as hot flashes or night sweats. So, two very common and often taboo symptoms that can be shifts in libido and changes in vaginal to vulvar tissue, and resulting in dryness. So, JP, I'd love to just dive right into the deep end and chat a little bit about some of these changes referred to as GSM, which stands for the gentle urinary syndrome of menopause. That just it's like medicalization of our modern of our transitions can be really clumsy, isn't it? Also known as vaginal atrophy, which frankly is just the worst word. So can you talk
Yes.
briefly about GSM, what it is, and offer some solutions, such as what are some good moisturizers?
Right. Well, the vulva, and when we say vulva for a lot of vulva means the outside part of the genitals for people who identify as women or female. So that's the head of the clitoris, the clitoral hood, the inner labia. It's the part that you can see on the outside. That's where the opening to the vagina is and the opening to the urethra. And then the vagina is actually the tube or the entranceway into your body. Um, Several tissues on the vulva and the vagina are particularly sensitive to estrogen. There's lots of estrogen receptors, especially inside the vagina on that mucous membrane. And right at the opening of the vagina, it's called the vaginal vestibule. It's like just at the opening. That area right there is also really sensitive to estrogen. So as estrogen decreases in our bodies due to any number of things, like this can happen from aging, this can happen from hormone fluctuations that are due to medical, different, like a huge variety of issues.
To me, yep.
Yes, so people experience significant dryness. Sometimes it interferes with their sex life, with being able to experience the kind of sex that maybe they're used to or like to have, especially if it's penetrative vaginal sex. It also can become so dry and uncomfortable that it's uncomfortable just for daily activities like walking or running. And sometimes that dryness, it can feel painful, but it can also sometimes feel to the body like an itching or burning sensation too. And that's actually just the dryness. Um, Luckily, there are lots of really good topical, non-hormonal, super easy peasy ways to find relief for that. A lot of people will talk about lubricants, which we will. We'll talk in depth about lubrication, but there are also a few companies are starting to make things that are just vaginal moisturizers. So they're not designed for sex. They're not slippery to reduce friction for any kind of intercourse or sexual activity. They're really just designed as a moisturizer. And I have one of my favorites here. This is by a company called Ah Yes,
Hmm.
and it's just a vaginal moisturizing gel. This has some really, first of all, it's the best formulated vaginal moisturizer, I think, in the whole world, easily.
What's
The women who
so
own
what
this company. Hmm?
sorry, go ahead. I didn't mean to interrupt you. What is it that you like about it? What is the ingredients that it makes it so great? Because
Um,
I've seen a
they
lot of not so great things out there for sure.
totally,
It's
yes,
like Snake Oil City out there. Yeah.
totally, yes, absolutely. This is actually, again, not designed as a moisturizer, and it has a guar gum agent in it that helps it stay on the walls of the vagina. So let's say you use
Wait,
it as part of
you
your.
said you said it's not designed for moisturizing, but it is. You
Oh,
just
I'm sorry. It's not designed as a lubricant.
yes.
Yes.
Okay. Thank you. Just
Thank you.
want to clarify. Yeah.
Not designed as a lubricant. You use this daily as a moisturizer, like you use on your face routine, basically. And it stays attached to the lining of the vagina in a way that lets all those good, like the aloe in it and all those good hydrating ingredients stay there and really plump up and pump up those tissues every day. After 4 to 6 weeks of using this, people will notice a tremendous difference. So I love that. Should we talk about lubricants?
Sure.
Okay. So there are some lubricants that I really love, particularly for folks that are experiencing perimenopause or menopause. Many of those lubes, they're water-based lubes with hyaluronic acid. And I mean, it has the word acid in it, which sounds a little scary. But if you look at all your like fancy eye creams and cosmetics, a cosmetic grade hyaluronic acid plumps up tissues, is moisturizing, helps cell regeneration, which is one of the things that estrogen used to do for the vagina, help those cells regenerate fast. And now they're not regenerating as fast. So anything with hyaluronic acid is super helpful. My very favorite is by a company called Hathor. This product is called Sutil Lux. It is fantastic. Hyaluronic acid in there. And also this one, now this one's available at like Target or Walgreens, super accessible. It's the Good Clean Love in the blue bottle. They make one that's in a green package. That one's a great lube, but it doesn't have that hyaluronic acid like this blue bottle does. So these are my two favorite water-based lubes. Sometimes water-based lubes just don't last long enough. I mean, part of the world of water-based lubes is they're going to absorb and they also evaporate. So you have to use, that's a really common mistake I see menopausal women making, is just not using enough lube or not reapplying it.
Yeah.
So it's not like you just use like a little like nickel size and like put it on your body and then you're good to go. No, I mean, you might start out with more like a quarter size, put some on both bodies if you're having partner sex, and then really pay attention to when you need to reapply. And you may have to reapply it several times if you're using this for a sexual scenario during the whole time that you're intimate. That's something to think about. The other thing is using coconut oil based lube. Now, this is not a water based lube. It's coconut oil. Coconut oil is really hydrating, wonderful for the skin. It makes a wonderful lube. It's naturally antimicrobial and antifungal. It is not condom compatible though, and we'll talk about that in a minute. So you could just use coconut oil. Go ahead.
I wanted to pause you on just backing up a little bit about, why some people might feel more inclined to use lube where they didn't have to before. And because, as you said, those as our tissue becomes to or starts to change with that lack of estrogen, it can become more painful. And also as the tissues, the linings begin to thin, there can be more risk of fissures or
Yes, or
bleeding.
even
So
micro tears.
yeah, right.
Yes.
So
So
this is where it might apply if somebody maybe who never used or needed lube before. No shame. Knock yourself out. Use as much as you want. And I think a lot of people stop having sex during that time in perimenopause because it hurts and they don't know why.
right. Yes, absolutely. The other thing is there is this everybody, regardless of age, really not everybody, but let's say most folks are going to have use for lube in their life. It is really a big social myth that you shouldn't need to use lube. And that using lube is like for people who are menopausal or perimenopausal or who have like an issue. But that is not the case. I can tell you after 20 years of selling lube to people that like everybody from all walks of life uses lube. And what I always say, it's better to have lube and not need it or want it than to need it or want it and not have it. So it's just like something that is just good to have all the time, available for everybody, I think. I mean, don't you think? I mean, it's like lube is a thing that should be in your like nightstand.
Would you be like, well, I only use chapstick during the winter? No.
Right.
I just
Right.
made that up.
Yes, that's a good one. Yeah, right. Like there's got to be
the shame in using
some lip
chapstick.
balm around here somewhere. Yes. Yeah,
Right. Yeah.
totally. Mm-hmm.
Well, let's talk a little bit about, is there ways to prevent? I mean, I know that's a loaded word. But is it possible to, I mean, because I've heard some physicians say, use it or lose it. It's, your vaginal tissue is also muscular. And, are there ways and steps that can be taken to increase blood flow and help support healthy tissue?
Yes, absolutely. And these are like from very basic like meta recommendations like drinking enough water, getting enough sleep, exercising, good nutrition, like all of that stuff really counts.
Mhm.
Using a good moisturizer and just having like good vaginal hygiene. And I don't mean cleanliness, I mean just like caring for yourself. But yes, absolutely using dilators, using vibrators, paying attention to your masturbation life, if you're not currently having sex with somebody else, all of that is important.
Mhm.
Um, Arousal, sexual arousal brings blood flow to the area and increases engorgement, and all that blood flow is really, really good for you. So that is true, that use it or lose it. That's a fact. That's absolutely true. And this is where I think a lot of folks um who are perimenopausal or menopausal now, we did not grow up, and even still to this day, there isn't good pleasure-based sex education in the United States really anywhere. So if you had comprehensive pleasure-based sex education that included all of your lifespan as a young person, you are in the significant minority of people. Um, so that is just an important thing to think about. And a lot of people who also are like, I don't want to use lube, might feel really uncomfortable masturbating too. And that's a real thing. And that is absolutely okay. No shame in not doing it, no shame in doing it either. But that is one way that can really help keep the vagina uh vibrant. um and like what's the word I'm trying to say? Um Vibrant, what's the other? Oh, who wants a
I like
vibrant vagina?
vibrant. I think
Everybody
that's
is
good.
vibrant. Yeah.
Vagina.
Yes,
I like it.
yes.
I feel really grateful that, I grew up with a, very like a awesome feminist mother. I grew up with our bodies ourselves. I, was taught that masturbation is good. It teaches you, how to learn more about your body and, how to share with your partner if you choose.
Yeah.
And I'm so grateful for that information. And, I think of it also as someone who's been doing, working with people to discover and empower their own sexuality. I mean, wow, it is ranges greatly, right? And how much how do I say, just sort of like just people's journeys, their comfort or discomfort. And, we all have our own unique journeys, right? And not one is, maybe it's something you've always sort of wondered about. And why, and if you feel curious, why not try now? There's no, or if, like as you said, there's no judgment if it's something that doesn't feel right for you. But most
Right.
important is how you feel, and sort of
That's right.
discovering these feelings. And it is also tissue, right? We have a lot of, and you must experience it tenfold of, how much um just stigma and social shit is put upon, particularly, sex and sexuality, that there's just so much there's a lot to traverse. I don't know, does that make,
There
where
is so much traverse, and so many of us walk around like not knowing what's normal, or
Mhm,
like if we're okay. Like we didn't know, like I did not grow up like you. I grew up quite the opposite, actually, which is part of the reason why I do what I do now. Because when I was a younger person, I needed a place like Smitten Kitten
mhm,
bad. My life would have been better had I had a place like Smitten Kitten at that age. And now I'm so thankful. Um, I'm so thankful for this place and to know what I get to experience and what's coming, and like have an idea of the road ahead of me.
mhm,
So like while our all of our journeys are really distinct and separate and individual, so many of our experiences are really alike too. And we don't talk enough about it. So I'm very thankful for you for doing this summit, and really bringing these topics up, because it can be a very isolating experience to not know what's coming, to not understand your experiences. And creating community, talking openly about menopause is so important. So thank you very
Yeah.
much.
Well, thank you. I'm really thankful. I've known Smitten Kitten since you opened and know how much work that you've done to help people and, communities, to just discover and explore themselves. And, circling back to what you said, I mean, and I'm certainly not without my, issues or, confusion or questions, certainly too. I mean, we're all on our own journeys. And as you said, each of them, particularly, when it comes to menopause, is, every person's experience will be different
Mhm.
and every person's experience is valid
Ye-
and relevant. And so, whether it's going through menopause or sex or both, it is, your body, what you're comfortable with. Plenty of people who don't know you and don't know you're going to know your body are going to tell you what to do. And
Yes.
I think that, like, that's where I think you and I really align, about, helping just provide more opportunities and resources for people to find what they need.
Right.
Yeah,
Yeah. Take what's helpful to you and leave the rest. Like
right.
that's fine. The concept is to like offer a plethora of information and resources, and people can pick and choose as they need. That is exactly it. Yeah.
Yeah, yeah. Well, circling back to all of
Yeah.
your
Where do we go?
incredible
Yes.
resources, you had mentioned talking about dilators and some toys. Are there any that you recommend? I mean, can we go down that road of things? I mean, I
Yeah.
know it's very subjective, but
Right. And
some
that's what I
people
was
might
going
not
to
even
say.
know what that is.
Exactly. So, dilators are just small, insertable, usually silicone, sometimes acrylic. Just you want to make sure it's made of a nice medical grade material that you use for vaginal insertion. And they start out like very small, like pinky size, even.
Mhm.
And then gradually you can get bigger. So, folks that have had a degree of vaginal atrophy where their vagina is closing, and maybe isn't even able to open enough to fit a speculum in, that's a really common experience too. Sometimes you can work with your general practitioner. There are even people in the world called pelvic floor physical therapists that help you use these therapeutic tools. So a dilator is often used in therapy, actually, but you can also get them and use them at home if you'd like, to just like gradually get the vagina feeling comfortable, opening a little bit more each time in a way that's like non-painful. You don't want anything to ever hurt, but just like slowly so you can reverse that process too. That's the other thing, is no matter your age or where, how long it's been since you've experienced menopause, or how much the vaginal atrophy has impacted your life, bodies are amazing and resilient, and with work you can reverse the effects as well, with a nice regimen of moisturizer and dilators.
Yeah.
And then just as a general rule, vibration increases blood flow. And so even if the vagina has shrunk, it's gotten shorter, maybe it's gotten tighter, things are uncomfortable, you might still be able to use a vibrator just for clitoral stimulation to increase sexual arousal. And that also will increase your body's natural lubrication and blood flow. And so any vibrator, and a vibrator is just a thing that vibrates. That's it. They of course come in all different colors and shapes and looks, and like there's like a billion to choose from, and that's all personal preference. But just in general, something that vibrates and has variable speed, something that goes from very low to maybe a pretty significant power increase that you can control as the user, anywhere in between, are the kind of things I recommend. And you don't have to spend a lot of money. You can buy a really nice vibrator for like $30, let's say between 30 and $50. You can spend more if you want, but you do not have to. This doesn't need to be like a big investment or anything. Um, excuse our phone. I'm sorry. We're at work today.
No worries.
Um,
Yeah, no,
somebody's
that's
calling to ask
awesome.
about vibrators, I'm sure.
Yeah, perfect. See, there, yeah.
Yeah.
So yeah, I love that. And I think that I think of it, having taught group fitness for many years, I think of, we're always working different muscle groups. And, this class that I started teaching called teaser size, we actually do Kegels
I
in
love it.
class, because
Yes.
Kegels, for those, who might not know, are just that contracting the vagina and, increasing that circulation. We sort of giggle when we do it. And,
Yeah.
it's like, because, it's important. It's also the muscle. So I love that, and probably a lot more fun than working your biceps. I don't know.
Right.
Again, it's
I mean,
subjective.
I
I don't
love the
know.
weight room myself. Yeah. Yeah.
I mean, I love me some body pump, but it's like a little extra bonus, doing
Yeah.
the vaginal work. So,
But I mean, that's a
well,
really good analogy
let's
though. I mean, it can be exercise, but it also can be fun. Yeah.
Yeah, right. Fun exercise. I don't know. I'm always looking. I mean, even though sort of exercise has been, my livelihood, but it's also like, it feels a little like I don't, who doesn't? Like, I'm sick of working out. I don't want to, but you know what happens when I don't? I feel like shit.
Yeah.
So it
Yeah.
goes for the whole body, yada, yada, right?
Mm-hmm. Mm-hmm.
So, let's shift to discussing some barrier methods. So I thought this was really interesting to discover that the biggest increase of in-office treatments for STDs has been reported to be patients over the age of 60. So can we just dispel the myth that people beyond 50 don't have sex and discuss the importance of continued safety?
Yeah.
And so maybe you could recommend, so what are some barrier methods that do you recommend, such as condoms or dental dams, and discuss what
Right.
these are to protect from STDs.
Most folks are pretty familiar with condoms. You can get condoms at any drugstore, your doctor's office, your therapist's office. Like most places are going to have condoms available. One thing I really want to talk to people about are dental dams, though, because a lot of people are not familiar with what a dental dam is, and they can be super helpful, super helpful as a barrier method. You can get dental dams that are made of latex, just like a condom. And basically what these are is they are a flat condom. Like if you cut the tip off a condom and then cut it up the size, and you'll end up with like a rectangle shape of latex or polyisoprene or whatever your condom's made of. And that is essentially what a dental dam is. And I'll open one up here. I just opened this package that I just showed you. And you just get a sheet of latex like this. And how you use this is you put it over any body part you would like to have oral to that body part connection with. So people use it for oral sex mostly. I have also seen people kiss through these. They are super soft, and they actually heighten sensation underneath it. So it might feel like, oh, I don't want to put that extra layer because I want to feel all the sensations, but actually it's quite the opposite. Actually, it enhances the sensation that's happening. Easy peasy. You just hold it, you put it over whatever body part you are interested in pleasuring, and there you go. That's it.
Awesome. And I think that it's sort of a understanding that, I mean, there are many STDs that can be contracted through the mouth. So I
Oh,
think that
absolutely. I
oral, for
mean,
sure. I mean, I think
yes.
people just think that it's like, oh, it's only vaginal or anal sex where I can get an STD. No.
No, no. And a lot of virally transmitted um infections
Mhm.
happen skin to skin too, and you may not even be able to see any symptoms, and the person who you're having sex with may or may not even know that they are positive for a particular virus. So um it's just an option. Like I said, it's like part of the buffet that we were talking about, like the information and the resources that are available to you to give it a try and see what you think. And it may or may not work for your needs, but that's okay. Just know that it's available, and you know, then
Well,
you can make that
more and
decision.
more is more. More
More and
information
more.
is
That's right.
better as far as I'm concerned, and it may not float your boat, and that's okay.
Yeah. And there's actually a newish company called My Laurels,
Mhm.
and they make latex underwear.
Oh,
Like single use, it's like a dental dam, but you don't have to hold it. And they're super stretchy because latex is stretchy. So they have a couple different cuts, a couple different sizes. They're going to fit most people. Easy peasy. And they're great. And you can find them online.
Does it seem like one of those things like, why is it taking
I
so
know.
long for somebody to invent something
I
like
know. It's a woman-owned company. Some amazing woman was like,
that?
had this idea and was like, somebody should do that. And she did. And it's
Smart
amazing. Yes.
lady. Thank you,
My
lady.
laurels. Yes.
Laurels. Awesome. Awesome. I love it. Well, lastly, are there any just final recommendations for aging people just to live their best lives with pleasure and joy?
There is one in particular sex educator who I really, really love, and her name is Joan Price. And I don't know if you're familiar with Joan. You know Joan?
Oh, I don't
Um,
know more.
Joan is amazing. So Joan wrote this book here.
Yeah.
Which way? Okay. The Ultimate Guide to Sex After 50.
Oh, wonderful. Oh, I'm getting that book.
It is so good. And this is her fourth or fifth book. She has written a whole series. She is in her mid to late 70s now and has just made all of these resources available. She also has a blog, and it's Joan Price, Price. Um, she does sex toy reviews specifically from the perspective of a postmenopausal woman.
Oh, cool.
So I think that's really awesome. And she has been doing this for about 10 years. I might be off of my time, but long enough that she has a lot of sex toy reviews on
Great.
her website.
Awesome.
And she works with all different companies. She's really great. So if I had one thing to say, or I want the folks joining us at the summit today, go check out Joan Price online. You can find her. She's everywhere. She's amazing. Her books are good. Her videos are good. Sex toy reviews are good. She teaches classes. But I
Fantastic.
think, yeah, having that information like from somebody who's already experienced
Mhm.
all of these things is just invaluable.
Well, I'm just so excited that, it really feels like a lot of us Gen X is starting to roll into menopause and perimenopause, and we're all like, what? Like
Right.
none of you gave us a heads up or talked
Yeah.
about I think that there's so much is changing, and I'm really grateful for just more of the open discussion and resources. And I did see behind your head one of my absolute favorite
Oh, yeah,
books
yeah.
ever. What Speaking of Gen X badassery, what the fresh hell, it's what the fresh hell is this, right?
Yes.
Yeah, which is
Menopause.
Heather Corinna, is that her name? Yeah.
Yeah.
Yeah, perimenopause, menopause, and other indignities in you. It's just the most
Yeah.
inclusive, wonderful, funny, irreverent book. I absolutely love it. And so I really look forward to reading the other one that you recommended as well.
Great.
So
Well,
thank
thank
you,
you.
JP. Thank you so much for sharing your wisdom today and just really the instrumental work that you do to support healthy sex and wellness for all humans. You
Thank
can,
you.
yeah, my pleasure. You can learn more and check out many of the products we discussed today at smittenkittenonline.com.
That's right. Thank you so much.
Yeah.
Take care.